Welcome to Redefining Medicine, an intimate and personalized program that illustrates a different side of the practice of medicine. Our in-depth conversations will focus on the physicians and practitioners who are redefining medicine through their integrative, functional, and holistic approach to health and well-being.
Welcome and thank you for joining our weekly podcast, Redefining Medicine. We are pleased to welcome back Dr. Erin Amato, an integrative psychiatrist, double board certification in General Psychiatry and Child and Adolescent Psychiatry. Dr. Amato is also a graduated fellow of the Fellowship of Anti-Aging, Metabolic, and Functional Medicine. Welcome back, Dr. Amato.
Thank you for having me.
Dr. Amato, your approach to psychiatry integrates a number of non-conventional approaches to mental health, including transcranial magnetic stimulation and IV ketamine and more. How are patients typically introduced to your practice, and how do you walk them through these non-traditional approaches?
I'm a part of a practice that has multiple psychiatric providers and therapists. So often the patients that come to me for those specialty treatments for treatment-resistant depression are people that are already seeing a psychiatrist or they're seeing a therapist. Sometimes in our community, it's that they've seen a primary care doctor and have tried a variety of medications. And they're usually coming to me when they've tried multiple medications, often over the course of several years or decades, and they're still not finding relief for their depression symptoms. Some of the patients find us also through self-referral, just through research that they've done, often through the internet, where they're looking for what innovative treatments are there out there for depression, because they just haven't had luck with the more traditional approach that typically utilizes medications or talk therapy. One of the biggest challenges I've encountered is just the lack of awareness that there is more out there that can help people with their depression or anxiety symptoms beyond just solutions with the prescription pad. So a lot of it is just trying to get the word out to people about innovative treatments and to get them thinking about new ways to try to address their problems. And this has even been true within the medical community. When I first started doing these treatments 5 and 6 years ago, there was a lot of resistance, I would say, within the psychiatric community still. And luckily, I've found, though, over the last few years that there's much wider acceptance as we just see there are so many people benefiting from these treatments.
For those who are not familiar or perhaps hold some common misunderstandings, can you please explain psychedelic psychiatry?
With the rising popularity of IV ketamine, and not just IV ketamine, but other delivery methods too, we're just seeing that this is really a breakthrough treatment for people who have suffered from depression and PTSD. And so there's really been a resurgence in interest in agents that work both on a neurochemical level to help people with these mental health disorders that are often resistant to other treatments. But also with psychedelic psychiatry, there's also a component of psychospiritual healing that can go along with these agents. And what we're seeing is there are over 20 university programs that have departments or studies that are now dedicated to psychedelic agents, including institutions like Johns Hopkins. And we're just seeing that there's a curiosity about this because there is such a profound response in some patients. Another one of the agents that's being used is MDMA, and that's in clinical trials right now for PTSD. I think we're going to see psychedelic psychiatry playing a much more prominent role as we have more research that is able to inform us about the utility of these agents as well as the safety. And I'm really hopeful that within the next 5 to 10 years, we're really going to see an expansion of being able to use these things, because we really do need whatever we can find to help expand our toolbox, because so many people are suffering from treatment-resistant depression and anxiety and PTSD, and they're just not finding the relief that they need from just medications alone.
Much has been written about the concerning effects of increasing social isolation, which, of course, has been exacerbated by COVID-19. How are you seeing the effects within your own patients?
Even prior to everything that's happened with COVID in the last year and the emphasis on lockdowns and social distancing, we were seeing an epidemic of loneliness in this country and an epidemic of people being very disconnected in their relationships and from their communities. And so within the world of functional medicine, we know what kind of an impact loneliness and stress can have, not only on mental health, but on physical health and on chronic medical conditions. So everything with COVID has really exacerbated that on a very grand scale. And what I'm seeing in my practice is so many people struggling, particularly our elderly, my older patients that have been so isolated and really frightened by what's going on in this past year. And then also the kids that have been out of school. Luckily, in Montana, where I'm located, we've had in-person school since the fall, and I am so thankful for that, because I know in other areas of the country where kids have been doing online learning, it's really been a challenging in terms of that loneliness and social isolation aspect.
Dr. Amato, what advice would you give to clinicians to approach the ongoing stress due to COVID-19 with their own patients, and importantly, within their own personal lives?
In terms of working with our patients, I think we just need to really make sure we're asking those deep questions about how are you really doing, and screening for conditions like depression and anxiety, and opening up that dialogue, because it might not be something that people volunteer, but if we normalize those conversations and we really check in with people about how they're doing with their mental health and how they're doing with their stress management, I think that's a very important aspect, is opening up that conversation. And then really helping to give people ideas of what they can do to help manage their stress on a day-to-day basis, but on a more chronic level, because we're a year into this now. And as hopeful as we've all been about life returning to normal, there's still a lot of ongoing disruption and stress and uncertainty. So we really need to open up the conversation to screen for these conditions, but also to give people tools that they can use to help manage this level of stress. And as far as the physicians out there and other medical providers, I mean, this goes for us as well. We really need to be checking in with ourselves to really kind of take an honest inventory of how we're doing with our mental health. And we need to be talking to each other. We need to drop the stigma that has been so common surrounding mental health conditions and open up that dialogue to where we feel safe talking to each other, having conversations about how overwhelming this can be, and then giving each other support to make it through. That's how we're going to get through this.
Thank you. And final question, if you could make one major change in the way that mental health care is approached, what would it be?
Well, going back to what I was just saying about stigma and really dropping the stigma around mental health and considering it as important as physical health, and opening up those conversations is so vital. But beyond that, really thinking about these mental health conditions like treatment-resistant depression or anxiety from a root cause level. For so long, the field of psychiatry has been identifying symptoms and prescribing medications or treatments that target symptoms, but not getting to the root cause of what's going on. So we really need to go deeper with our questioning. We need to be looking at our patients from a multi-systems approach, instead of just thinking about neurochemicals and medications that can be utilized. And be educating our patients about what they can be doing on their own in between doctor's visits with interventions that are going to change nutrition, talk about things like detoxification, lifestyle changes, movement. These are all things that empower patients to be taking better control of their mental health and brain health for years to come.
Thank you so much for sharing your insight with us today, Dr. Amato. We certainly appreciate your time.
Thank you for having me.